patient I spoke to today was talking to me about her endometriosis, which is reasonably managed at the moment after she's had 2 children. But she gets very, very painful periods, so debilitating. She can't do anything for a couple of days. And is that still acceptable in this day and age, really? This is a woman who has got good nutrition and exercise and supportive relationships. When I looked at her blood, her estrogen level was normal for day 21. It was in the normal range. But what makes it not normal is that her progesterone was below the level that I would expect to see on day 21. Not even below, like well below the range, like deficient. And one of the things I commonly see in endometriosis is that people can have a high or a normal estrogen, but their progesterone is really low. And it's this imbalance between the 2 hormones that can exacerbate your symptoms. So as well as looking at lifestyle and nutrition and stress management and gut biome, I do often prescribe progesterone in these cases, so we can bring the progesterone up so the imbalance is not as big. So hopefully the pain will be less and the symptoms you're experiencing will also be less overall. So I do think progesterone is really important in endometriosis, especially in that second half of the cycle, maybe from ovulation on or just before ovulation, because ovulation can be problematic for people with endometriosis as well, sometimes with extreme pain or fatigue or mood dipping, when ovulation technically should be the time of the month you feel the best. So by helping your body metabolize estrogen better with certain supplements like methylated B supplements or an enzyme called DIM, which has now gone to be prescription only, that can really help your processing of estrogen as well as then bringing up your progesterone. So naturally, you can bring up your progesterone with certain foods in the second half of your cycle, but also there's a supplement called Agnus Castus that can help. But this woman was taking Agnus Castus and her progesterone was still really low. So hopefully we're going to try the treatment plan that I've put in place for the next sort of 3 cycles. And then she's going to recheck her bloods and then hopefully we'll see some improvement. Her thyroid was also in the normal range, but slightly on the lower range. And this can happen if your other hormones are out of sync. So I'm looking forward to seeing her results in 3 months and hoping that she gets the benefits that she deserves.